actually help us. So the cancer research actually help us to understand how a cancer develops, how do we detect it earlier, and then how do we actually treat it more effectively as well. And thanks to research, I think nowadays we have better treatment. We have newer treatment like targeted therapies, immunotherapies, or even some ways for us to actually prevent some cancers because of discovery of vaccines, which help to actually even prevent certain cancers. So I would say that, without research, we wouldn't have all these breakthrough that help us to actually improve the survival and outcome as well as quality of life of our patients.
Correct. So it goes both hand in hand. I mean, research is important. The support from the medical industry is also important because it is with research, like you said, that we can come up with breakthrough treatments that will help patients. Today immunotherapy is a big thing. I think immunotherapy is about training the immune system to recognize and kill cancers in your body. So, as we are progressing, as technology is getting better, we also want to find better ways to treat people.
Yes.
Yeah. So my next question is, can genetic testing help identify individuals at high risk for certain type of cancer?
Yes. Genetic testing actually can help us to identify people who have inherited an abnormal gene or the mutations, right, that increases their risk of developing cancers. Like example, breast cancer, ovarian cancer, prostate cancer, or even colorectal cancer, right? So just to give an example specifically, so for example, a mutation in this genes called BRCA gene, BRCA genes, are linked to a higher risk of developing breast and ovarian cancers in female, right? So knowing your genetic risk can actually help you to take preventive steps, right? Like more frequent or earlier screenings, as well as lifestyle changes, to help you to mitigate the risk.
Yes. So I also understand with the BRCA gene, right? Because it's an inherited disease, there's also a certain percentage that can be passed down to the next generation. So as much as this information from genetic testing is important for you, but it's also equally important to family members who may be affected as well. They can also start taking prevention methods, whether it's early screening, like Dr. Tan has shared, or, the best person to talk to will be your oncologist that could advise you what is the next best step forward.
Yeah.
Okay. So, Dr. Tan, how does genetic testing help in the field of oncology when it comes to treatment and early detection?
So I think like I mentioned earlier, right? So when you do genetic testing, actually once you're aware that higher risk of developing certain cancers and all, so actually it helps in the sense that it helps for early detection, meaning that since you already have this high genetic risk, so you can start screening earlier or even more frequently. For example, when you talk about breast cancer, right? Just now we were talking about breast cancer. So if you look at most guidelines, you recommend that, if you are 45 or 50 years old and above, you should consider to go for general screening with mammogram or ultrasound. But bear in mind that all these recommendations or guidelines are for general public with low risk of developing this. But if someone has a high risk, meaning that the person is actually a carrier of this so-called BRCA gene, then it's actually not a normal risk person, right? It's definitely much more higher. So you shouldn't be applying using the general guideline for the general public to do that. So you can actually start screening earlier. Right? Example, because you have this gene in your family, say example, the mother was diagnosed with breast cancer when she was 40, then this individual actually should start considering going for screening even 10 years earlier, meaning that they should start considering going for the screening at 30 years old, rather than following the recommendation and wait till they're 45 or 50. So in that sense, it actually helps for early detections, because as we all know, the earlier you diagnose a stage of a cancer, right, the better the outcome is to the patient, right? But of course, on the other part about the benefit of the genetic testing in helping us as an oncologist is that sometimes they help us to personalize treatment for a patient. This is because certain cancers, right, when they have the mutation. So again, let's get back to BRCA as an example, right? So certain breast cancer patients or ovarian cancer patients, when they actually have this BRCA gene mutation, they're actually then suitable to be given targeted therapies, right? Like the PARP inhibitors, as part of the treatment for their cancer. Of course, this is not for everyone, but normally talk to your doctors, then your doctors will be able to advise. But if you do have certain genes in place, then the doctors will probably be able to offer you some targeted therapies, which generally tend to be more effective and have fewer side effects compared to traditional treatment like, say, cytotoxic chemotherapy drugs.
Okay, so this targeted therapy means it will work better because you're having this particular gene mutation. Am I right?
Yes, because you have a target to work to act on, right?
So it's more specific.
Yes, so there tends to be higher chance of working, as well as lesser side effect, as opposed to, you are giving something which is more broad-based, target everything. Also, chances for them to actually work will probably be lower, as well as higher side effect at the same time.
Okay, so I know we've spoken about genetic testing and how important it is, but I think it's important to highlight the role of a genetic counselor as well. I mean, there's a lot of genetic testing out there, but the role of a genetic counselor is equally important. And what is your take on it?
Well, I think it's extremely important. Normally, when I advise my patients for consideration of genetic testing, the first thing I will do normally is that to refer them to a genetic counselor, right? So the reason for that is because I think the genetic counselor will be actually able to counsel the patients before and after the test, so that they can actually understand what the result means to the patient as well as to their family members at the same time. And beyond that, it also helps the patients to be prepared mentally as well on what actions can be taken when the result is out. Because you do not want the patients to go straight to have a genetic testing done, and then when the results come out to say that, oh, you are a carrier, right? You have this gene in you. So, and then subsequently, only you start to think about what you should do.
Correct.
So I think, so we do not want to put the patient in such a tight spot, you see.
Correct.
So we want to
Unnecessary
give them, the counseling prior to that, so that they are mentally prepared on, say, example, if the result were to come out as A, or positive, then this is what I'm going to do. If it's come out as B, this is what I'm going to do. So they already have that in place mentally, so that then only they'll proceed with the test. So I think the role of the genetic counselor is just very important.
Correct. Because I understand that as you mentioned, you don't want to push everyone to go for genetic testing. Those who are high risk need to go, because if the result is not conclusive, it just causes unnecessary fear in people. As I've conducted a lot of these talks, and I know cancer is always a topic that people are still very fearful about.
Yes.
And we hope someday with research and technological advancements, cancer can be a disease where you can just pop a pill, and that can yes, true. Just like a common flu and all that. We hope someday we'll come there with research and technology changing and advancing. So, Dr. Tan, there's a lot of information on the internet that people love to follow when it comes to cancer. People start Googling, start researching. Sometimes they even come to the doctors and say, this is what Google told me, or this is what ChatGPT told me. I'm sure you have encountered similar situations yourself. Okay. So I just want to just go through a few questions just to ask you myth or fact when it comes to cancer. Okay. So eating sugar makes cancer grow faster.
So, right? Reason is because actually, yes, indeed, cancer cells do consume sugar, right? But actually, they consume sugar just like the normal cells in our body, because all the cells in our body require sugar for them to function, right? So by eating sugar itself, actually, it doesn't directly cause the cancer to grow faster, or the cancer coming back and all. So I think the thoughts or the idea, in terms of like trying to starve the cancer cells by not eating sugar and all, actually doesn't really work. Because I think whether you are eating something which it tastes sweet or it doesn't, somehow it will be converted to sugar, which is glucose in our body, because that's where our normal cells, need that sugar to function, our normal day-to-day function as well at the same time. So I would say that this is definitely a myth.
Okay. Second, only smokers get lung cancer.
So I think earlier we did touch on this as well. So I think again it's a myth, because yes, smoking is the biggest risk factors for lung cancer, but we also do see a lot of non-smoker can also get lung cancer, mainly due to secondhand smoke, air pollution, or even genetic factors. And in fact, in Asia, based on thanks to research, being conducted, like some of those being done like from Cancer Research Malaysia as well, I think we do know that in Asia, we tend to have a higher female populations, non-smoker, who tends to get certain types of lung cancer as opposed to our Westerners or Caucasians friends, you see. So all this is thanks to the research that is being conducted. Yeah.
Yes, agree. When I also got the information and when I heard about it, it is also a bit surprising and shocking at the same time because women and non-smokers are at high risk in Malaysia. So it is something that everyone should know about and should be aware about.
Yep, yep.
But if you have a family history of cancer, there's nothing you can do to prevent it.
I mean, I would say that is definitely a myth as well at the same time, right? So I think we talked about earlier, having a family history means that you are potentially at a higher risk, right? But it doesn't guarantee that you will be getting cancer as well, right? So I think things like regular screening, healthy lifestyle to how to reduce your risk of developing cancer, and sometimes in certain cases, preventive measures, right, can be done as well to help you to reduce the risk. So probably we can also, again, goes back to one of the example like BRCA genes. So I think one of the famous actress in the West, right, she has this, Angelina Jolie. So she actually has these BRCA genes in her. So before she actually developed the breast cancer or ovarian cancer, so I think she has decided to actually remove both her breast as well as both the ovaries, to help her to reduce the risk of getting this cancer. And of course, these are in especially the Asian cultures, we thought that this probably could be something more too drastic for us
Yes.
to do it, you see. So, but again, I think everyone has different risks as well as different options in terms of different opinion in terms of like what they want to do.
Correct.
I think the best way forward is actually to speak to your doctors, to find out more about your risk and then what are the options, and of course the pros and cons of all these options, make available in front of you. And then finally, after discussion with the doctors as well as your family members, then you probably can make the decision on which option probably best suited the patient themselves.
Correct. Cancer is always a death sentence.
It's definitely not that case, right? I mean, we are curing a lot of cancer patients, and I think cancer treatments has improved dramatically over the years, right? And in fact, many cancers can be cured nowadays if it's caught early. And even advanced cancer patients often can be managed for years, with new treatment. I think probably, I always like to give example to illustrate, so that people can see the difference. Talking about, say, maybe 10 years ago, like for lung cancer, when someone is being diagnosed with lung cancer, stage 4, right, I would say that majority, like 90%, 94% of the patients will probably pass on at 1 year, right? Nowadays, with the advancement in terms of the treatment for lung cancer patients, even with stage 4 at diagnosis, right, as high as 20% of the patients are still around beyond 5 years. You see? So, generally we are talking about 5 years as the cut-off traditionally, as a cure for cancer, right? So if let's say you have a cancer, if you're still around at 5 years, meaning that you're cured. So nowadays we are talking about, advanced cancer patients who can actually live on for years or even 5 years. And more importantly is that not just living longer, but at the same time, they're actually having a good quality of life, meaning that the treatment that we're offering the patients actually has fewer side effects, so it doesn't affect and disrupt their activity, day-to-day activities that much. So generally, we are actually moving towards the direction like, advanced cancer, just like a chronic disease, like a diabetes or hypertension, where we might not be able to cure the patient, but we will be able to offer treatment to the patient to control the disease, so that patient can go on to have their usual day-to-day activities, and they just probably need to pop in regularly to the hospital or check out and continue with their medications.
So as long as much as we can, we allow them to have a normal life.
Definitely.
Yeah. And the last one, eating organic food prevents cancer.
I would say it's a myth, right? Of course, we all do know that organic food is free from pesticide or chemicals, right? But actually, there's no strong evidence scientifically to directly prove that it actually helps to prevent cancer, right? Of course, we know that eating a balanced diet with a lot of fruits and vegetables does help to lower down the risk of developing cancers, right? But just by eating organic food itself doesn't prevent cancer because we do know that, food itself is not the only cause for someone to have cancers because there are also other factors involved in the same time.
Correct.
So it's a myth.
Okay. So thanks a lot, Dr. Tan. I'm just going to briefly go through to explain about genetic testing and the genetic counseling team here at Cancer Research Malaysia, as
Yes.
well as the fundraising project that Cancer Research Malaysia is working on. Slide. Okay. If you're interested to know more about genetic testing, you can actually connect to us. This is Genetics, wholly owned by Cancer Research Malaysia. And what do we have? We have genetic counselors. So genetic counselors, like Dr. Tan was saying, they counsel people, they make them understand about the entire test because we don't want to simply tell everyone to go for the test as it can cause unnecessary worry. So that's why we have experts. They're actually qualified professionals. They have license in order to be genetic counselors. Okay? They help us to understand genetic information better, interpret the genetic test results, and you can receive guidance and emotional support from them. Because sometimes getting the results can be a bit scary. So they are trained to be able to help you navigate through these challenging times as well when it comes to your test results. So this is actually our certified team of genetic counselors. This is our advisor, Professor Dr. Tong Myong Kyong. He's a consultant clinical geneticist. And then if you have any partnership inquiry, you can get in touch with Dr. Lo Lei Han or Yoon Sok Yi. So what are the services that are included? Common hereditary cancers, breast and gynae cancer, colorectal cancer, prostate cancer, and personalized cancer risk assessment. These are the services that we have. So just to explain to you about the patient journey, you can actually send us a WhatsApp, and then we do a pre-testing counseling. And then if you are at high risk, we will send your sample collection for genetic testing. And then even post the result, I mean, after you get your genetic test results, there will also be a genetic counseling that the team will meet you and speak to you. So this is an example of the package that they offer. If you have any questions, you can actually contact this number at the bottom here. You can send them a WhatsApp and they'll be happy to answer you. Last but not least, this is the end of the webinar. So if you would like to hear more about this kind of webinar or the things that Cancer Research Malaysia is doing, please take a screenshot of this QR code here, and it will take you to a Linktree account where you can check us out on our Instagram, our Facebook, and also our website. And yes, I would love to hear from you how the presentation today went. What other topics you would like to hear? Is there any other topics that you want us to come up and present about? So please take a scan of the QR code here. And I'm going to switch screen to the next one. It's a short one before I go. Okay, this is the one. So coming up, we actually have a charity comedy night happening on the 23rd of February, this coming Sunday, at 7 p.m. in HGH Hall. So, proceeds that we collect from this charity night will go through Cancer Research Malaysia so that we can continue doing research on on cancers that affect Asians. Why is this important? I think Dr. Tan has also spoke about nasopharyngeal cancer, whether it's lung cancer. he shared about how nasopharyngeal cancer, it is very prevalent in the Chinese ethnicity group, in the Bidayo group. And it is through research that we find out all this. And we hope with research we can come up with better treatment, better early detection tools so that people can continue to survive the disease. Okay? And so do come and support us. You can scan this QR code here, to go and donate for a ticket and come for the show with your family and friends, and do spread the word around as well. So we will go to the question and answer session. Okay, there are a couple of questions waiting for you, Dr. Tan. Let me read them out. How effective and common the immunotherapy to treat cancer? I heard it's very expensive. And roughly how much is the cost? I think this really depends on the hospital and where you're located.
Okay. So I think firstly, immunotherapy, it is one of the newer group of drugs or medications being used to treat cancers. And as we mentioned earlier, why is it being recommended? It's mainly because they have undergone lots of research, cancer research, on the usage of immunotherapy and whether it actually helps to improve patients' outcome or not compared to the standard of care, right? The standard treatment for that particular cancer prior to that, right? So of course, immunotherapy is not something for everyone, okay? So ultimately, you should speak to your doctors because it will be depends on a lot of factors like, what cancers that we are talking about, what stage it is, and then there are also some additional tests that we need to perform before we will be able to advise whether a patient's, will need immunotherapy or whether the immunotherapy will make any difference and add on benefit to the patients or not. With regards to the cost, right? So again, there are lots of immunotherapy currently available in the market, okay? So in general, I would say that the ballpark figure for one cycle of immunotherapy will be somewhere in the region of 5 figures at the moment. So, but I think together with more research ongoing and being more immunotherapy being approved to be used for treatment for lung or cancer patients, right? I think we can see that the cost of immunotherapy is slowly coming down, over the years. I think we in the near future with more immunotherapy being approved, I foresee that the price will come down to even be like around the region of 4 figures one cycle compared to at the moment is in the 5-figure range.
Okay. Thank you, Dr. Tan. This is from Irene. Is there any research where blood tests can detect cancer? When you talk about genetic, what if a person doesn't know his family medical history? Do you have to wait for symptoms to only test for cancer?
Okay. So I think, like you did mention earlier, Vishala, I think one of the services are offered by genetics. You guys will be on the personalized risk as well. So I think the best way is actually to meet up with the genetic counselors, share with them what do you know about yourself and immediate families and all before they actually, then advise you what will probably be the best way forward. I think, of course, we do know that nowadays because of the internet, Facebook, etc., there are companies who are offering this so-called blood test to detect cancer, right, early, or what we call MCED, in short, which stands for Multi-Cancer Early Detection Test, right? But what I would advise against this test is mainly because of a couple of reasons. Number one, okay, like I said, you do not want to perform the test without going through the genetic counseling process. Because, for example, I'll just share you an example, right? Say you have done a test that you bought from online. The result come back to say that, okay, example, this lady, you actually have BRCA gene. So you have a much higher risk of developing breast cancer or ovarian cancer. Then what you're going to do? So we do not want you to be in such a situation where you felt helpless, you do not know what to do after that. Because when we actually offer this kind of test to patients, I say we want the patient to be prepared, when they go and do the test and receive the result later on so that they know what they are going to do.
Right.
And in the event the patients do have higher risk to develop certain cancers, we also have the follow-up schedule we have the things all in place so that we can support the patients, throughout the journey, rather than putting them in a tight spot, where they'll be at a loss and they don't know what to do.
Correct.
So that's one. Another thing is that some of these tests that's being offered, outside, they might not be validated. Validated meaning that, you do not know whether you can trust the results or not. So ultimately, if you do not know whether, how reliable is the test and you perform it and the result come back, it can only cause unnecessary anxiety, unnecessary procedures that need to be performed subsequently. You're going to waste a lot of time, a lot of money, and yeah, so it will affect a lot of things. So we try to prevent all this, So ultimately, my advice is to go through the proper channel. So, meet a genetic counselor. Yes, you might not know much about your family history, but meet a genetic counselor, share with them, what information that you are able to provide, and then let them do the assessment. And then if let's say they think that you are at higher risk and you might benefit from genetic testing, so after the counseling, then go ahead, rather than without knowing anything, and then you just buy a kit from the online and then test it, and then when the result come back, you feel helpless because you
Exactly.
don't know how to interpret.
Yes.
Worst case is that if the results say that, oh, it's positive, then what's next? You see?
Yes. Correct. Yeah. So it's very crucial to have someone that can support you in this journey, and that would be genetic counselors.
Yep. Agree 100%.
Okay. Thank you, Dr. Tan. The next question is, what is the reason colon cancer are more common than other type of cancer?
I mean, to be honest, I do not know the exact answer to that questions, right? I think somehow we do know that certain cancers are more prevalent, more common. So it could be because of, like I said, genetic predisposition. It could be because of exposure to our lifestyle, like food and things like that. So I think one of the reasons, that people hypothesize for colon cancer is that it's because of the food that we take nowadays, in a way that is less natural, a lot more like, fat, food, preserved food, canned food, all these things. And hence, because of that, so we tend to have a higher risk of developing colon cancer. So that's one of the hypotheses that people have, in terms of our lifestyle, that we are eating less fruits or vegetables and things like that. But again, like I said, most of the time, the development of cancer is multifactorial. So it's very difficult for us to pinpoint one exact reasons, because people will say that, oh, I have been eating veg and fruits all the time, and how come I still develop colon cancer? Whereas, that person who smokes nonstop, throughout his life, do not get lung cancer is because I think generally we can only make a general assumption that, some of these things are risk factors and it increases the risk, but that doesn't mean that if you're exposed to that risk factors, you definitely have cancers.
Cancer, yes.
Because the development of cancer is actually multifactorial and it's actually a complex process.
Yes, correct. Okay. The next question. So this patient said that her mother died of breast cancer, stage 4, 3 years ago, and she wanted to know what are the basic screening that you suggest for her family, like her sisters. So I would think like frequent screening, mammogram. Is there any other thing that you would advise?
Yeah, I think that's one of the things that can be considered, right? I mean, because having a family members with breast cancer actually will increase your risk of getting breast cancer as well. So the good thing is that it makes you aware of the disease, right? Then you can start off with doing like breast self-examinations. Then you can go to the nearest hospital to do your screening, like mammogram, ultrasound, because ultimately there are a lot of other things that we need to consider. Example, at what age Punita's mom was diagnosed with breast cancer, right? Because let's say she were to diagnose with breast cancer when she was in her, say, 40s, as compared to when she was diagnosed in the breast cancer when she was in her 70s or 80s, it makes a difference to us, whether most likely that is because of genetic predisposition or it's because more of like, environmental reasons. And of course, at the same time, we also need to know, like, how old is Punita and her sister right now, whether they are actually in their 20s, whether they're in their 30s, 40s, and all. So all this information is important for us to actually make the recommendation. So like I said, we need to personalize and individualize everyone's risk factors because everyone is different. So the best way forward, again, is still to, meet with the healthcare professionals, including the genetic counselors, and share all this information with them for them to do a proper assessment, in terms of your risk, and then they will make the necessary recommendation to you.
Okay. So last but not least, we don't prefer giving advice online, but I will just read out this question to Dr. Tan and
Yep.
see what he says. Okay, so this person says that her mother is 63 years old and is going for her first dose of chemo tomorrow. And she wanted to know, could you share recommendations on what to do for someone before and after going through chemo?
Yeah, so Ishala, I think you are completely correct just now, in the sense that I think it's very difficult for us to actually make recommendation because there are a lot of information that we do not know.
Yes,
Right?
yes.
I think firstly, okay, just purely based on the question itself, there are a lot of things I do not know. Example, I would not know how's the parents' condition,
Yes,
whether
yes.
to have any underlying medical problems,
Hmm.
what cancer it is, at what stage, what was done, as well as what treatment that the doctors are going to offer the patients,
Correct.
as well as at how's the fitness level of the parents at the
Yes.
time when they are supposed to go for the treatment. So all these things might influence, the decision and how the patient is going to cope with the treatment and all. But in general, right, just to share it in general, your doctors who are going to prescribe and offer this treatment will be the best person, to access as well as to give the advice to you and your mom. And most of the time, what we do is that we'll do the necessary process where we will try to offer the patient a treatment, and try to do some preventive measures to help to reduce the side effect so that the patient can benefit from the treatment, the patient can complete the treatment safely and all. But just purely based on the limited information that I have, I will not be able to give more advice than this. Yeah.
Yes. So I hope you all understand. There are things that we can speak about, but we can't give like online consultation and things like that. The doctor needs to know your history. The doctor needs to know your medical history as well. So we have come to the end of our webinar this morning, Dr. Tan. I would like to thank Hospital Picaso and Dr. Tan for their time and giving us this opportunity to speak to all of you all. Thank you everyone for attending. Thank you, Dr. Tan. And we hope to meet again soon. Thank you, everyone.
Thank you, Vishala. Yeah,
Thank
and thank you to Cancer Research Malaysia for the wonderful work that they have been done to contribute, for the cancer care in Malaysia as well. Thank you so much.
Thank
Thank
you.
you, everyone. Have a good
Thank
day.
you. Have a good day. Thank you.